Hello, I'm Dr. Lynne Padgett, and I'm a clinical health psychologist. I'm here with the Reverend Dr. James Brewer-Calvert. He's a colon cancer survivor. Cancer survivors are often affected by mental health problems, but for some patients, talking about these challenges is far more difficult than talking about physical health concerns. These are not always easy conversations for providers to start either. Cultural beliefs, worries about stigma, and negative attitudes about mental health can all play a role in how difficult these discussions can be. James is going to tell us about his experience talking about mental health issues with his healthcare providers during and after his cancer diagnosis and treatment. James, welcome.
Hello. How are you, Doctor?
Good, thank you. We're
Excellent.
delighted to hear your story.
Thank you. So in 2005, my father passed away from colon cancer, and he had been diagnosed in 2003, and he was given 20 months to live, which is about as long as he did live after that. But he used that time to say goodbye and thank you to everybody. It was a very gracious opportunity for us to connect with him, even though it was very difficult and we miss him terribly. In 2015, exactly 10 years later, I was diagnosed with colon cancer. And so in May of 2015, I was given a few days before surgery, and so I went around saying goodbye and thank you to anyone who moved, because I figured this was it. And it was a very frightening time for me as well as my family. I was blessed to have a doctor who cared about me in a very holistic way. We connected on a level of faith. He was Jewish and I was Christian. He had a wonderful temple, I had a wonderful church, and so we were able to share stories and about that, and he would ask me how I was doing and what I was feeling and thinking. So I felt I had a kinship person in this process. And then when I came out of surgery, and miracle of miracles, I lived, went on to meet with my oncologist, and as I went through 6 months of chemotherapy, he also dealt with me on a very holistic level. He made time to see how I was doing, and I was able to tell him what I was experiencing, the highs and the lows, my fears, my challenges. And I also noticed that in the waiting rooms at pre-op and also in the chemo lab, I call it the cancer ward for lack of better language, that people were very sad and stressed. There was a lot of grief, a lot of loss, a lot of pain, fear, worries, and going through chemo is an awful experience for everyone. It's an equal opportunity offender. You know, it attacks everything that's living in your body. And so I would walk in and say, it's another day of healing. Try to turn the tables on fear and give people hope that this was a healing process. I would hope that doctors and nurses would use this opportunity to connect with their patients on a very holistic way. Just say simply, how are you? What are you going through? And that makes all the difference in the world sometimes. Let me ask you a question. So what issues or concerns do you think that patients should tell their providers? And what should providers tell their patients when it comes down to finding out where people are in this process?
All right. Well, James, first of all, I'm really touched by what a positive experience you had sharing your highs and lows with your providers and getting really positive responses from them. And of course, that's what we all hope for. For patients, it's important to know that the whole person is the target of care and the whole person is important. That includes communicating to your doctor physical and psychological or mental health symptoms. Those symptoms are all important and all make up the totality of your care. One of the ways that we try to elicit that information from patients is through distress screening. So it's an opportunity for patients to check off what symptoms they're experiencing, and those include physical and mental health symptoms. So things like depression, anxiety, fear, some of the things that you mentioned. That's a way to report it. One thing that's really important for patients to know is that the symptoms, mental health symptoms, that they discuss with their provider are also protected and confidential information, just like their physical symptoms are. So that's what I'd tell to patients. For providers, I think it's really important to know that even sometimes if they do ask, and we encourage them to ask or to discuss the results of screening, but that even if they do, patients may have social, cultural, religious, or personal beliefs that make it difficult for them to talk about mental health symptoms versus physical symptoms. And so it's important for providers to really reach out and encourage them to talk and to recognize some of the barriers that may keep them from speaking about it.
Do you think that there's a tendency for medical personnel to think, oh, I've got to rush through this process because there's a long line of patients lining up behind, and I really don't have time to ask, how are you, because that might put me off schedule?
I think that that's probably an external pressure that providers can feel based on scheduling. I think it's a pressure that patients can feel too, about getting everything covered during the visit, and it may be easy for both providers and patients to discount those mental health symptoms, but what we know is that those are important to the totality of care, and that for good physical and mental health outcomes, you have to address both of those during the visits. Providers don't have to solve the problem in the visit. They just need to be aware of asking, recognizing, and then referring patients to cancer center resources or perhaps resources in their local community.
I felt very strongly throughout the process that my doctors and nurses saw me holistically, that I was being treated body, mind, and soul. And I try to act accordingly with them. But that was a very helpful part of the healing process. And so I'm grateful for them.
Well, you certainly had a very positive experience, and that would be our goal for all patients to experience.
I hope so. I hope so. Doctors and nurses have a real opportunity to reduce the impact of problems like these and help cancer survivors like me live happy, healthier lives.
Open communication between healthcare providers and patients regarding cancer-related mental health concerns is an important part of care. Healthcare providers can make this communication easier by assessing patients' cultural, social, or stigma-related beliefs first. For access to healthcare provider training resources and information about the topics discussed, visit cdc.gov/cancer and chronicdisease.org.